Now we have a dialogue with the National Health Authority. I would like to welcome RS Sharma, Chairman, EGTDM and CEO, National Health Authority, and T. Radhakrishna, Editor, South, ETGovernment.com for the session. Over to you, gentlemen.
Dr. RS Sharma, Chief Executive Officer, National Health Authority. Sir, welcome to ETGovernment.
Thank you very much, Mr. Radhakrishna, for having me on this program.
Sir, world's fastest tech platform, CoWIN, has joined the India's trump in building Made in India digital platforms, Aadhaar and UPI. This is perhaps the first time any nation is making a software platform adopted by its public sector open for the world. As a senior administrator, how do you describe the scenario of developing sectoral digital platforms for the nation building?
Now, let me begin that it is the inspiration of our Prime Minister, which actually propelled us to make this platform. The Honorable Prime Minister, kind of assigned this work to me and made me the chairperson of the empowered committee on CoWIN administration. And then the journey of building this platform, CoWIN, began. And within, as you rightly say, within 6 months, it has grown to 450 million, users, as many registrations, and it is actually working in a very, very seamless manner, creating a completely digital journey of vaccination in this country, providing freedom to the people to get vaccinated wherever they want to get vaccinated. The first dose may be at place X, the second dose may be at place Y, and it's a completely people-centric platform. As soon as they get vaccinated, they can get their digital certificate, which is verifiable, non-repudiable. So I think it has come out to be a very standard, very good, robust platform. It has also sustained very high volumes of transactions. So, for example, on 28th of April, when the country opened the registrations for 18 years plus, the platform saw 13.7 million, that is 1.37 crore registrations in a period of 8 hours. And of course, a billion hits in that same period, more than a billion hits. So I think that also has proved its robustness. The platform is also based on what is called an open architecture. So there are open APIs which we had published. The APIs were published actually when the platform was being developed itself. So the APIs is not an afterthought. The whole concept of API is that one can build applications on top of the platform which can connect with the platform in a standard, using the standard API protocols. And that is how we allowed the private sector to develop their applications. So as you know today, very large players like Paytms and Infosys and many other systems have connected with this platform and providing services to their customers for enrolling on the platform, registration on the platform, so stuff like that. So this is a way, an open platform. And finally, the Honorable Prime Minister again told us in the month of May that once this platform has been developed, there are countries which are showing interest, and therefore let us make this open source, completely open source, and let us give it to the world as a gift. So we actually started work on that. We have completed the work of creating an open source stack, removed all India specific references and variables from the platform, created a training material, and actually empaneled number of agencies which will help the other countries to deploy the platform in their country. So basically we are training them, we will certify them. And ultimately we had a conclave on CoWIN on 5th of July this year. And there were a large number of countries who participated, and many of the ministers of those countries also participated. And now there are interests being developed, interest being expressed by those countries to take the journey forward. And now we, with the help of the Ministry of External Affairs, are actually going to sort of start deployment and use of this software in those countries. Aadhaar and UPI are two systems which have which have been going on, and now they have delivered as promised. In some sense, Aadhaar is now 1.29 billion strong. Almost everybody in Aadhaar, everybody in the country has got Aadhaar, and Aadhaar has created a huge amount of other sort of transformations. For example, the financial inclusion. Now 80%, more than 80% of the adults in this country have got bank account now, which is actually a great financial inclusion. I don't think any developing country at our income levels has that much of financial inclusion. And Aadhaar, Janadhan Aadhaar and mobile, they all became the instruments of ensuring financial inclusion. So that is something which is very, very important. Similarly, there are other utilities which have been created on top of Aadhaar, which we collectively call India Stack, which is the electronic KYC, which is the authentication services of Aadhaar, which are actually being used for deliver food grains in the country, delivering direct benefit transfers to billions of transactions are happening. So there are a number of things which have happened on top of Aadhaar, and there have been huge savings because Aadhaar has been instrumental in removing the duplicates and fakes from many beneficiary databases. So I think it has truly created a revolution in the public, in the governance systems of this country and the delivery systems of this country. Aadhaar is central to India's delivery systems as of now. Similarly, UPI basically has democratized the language of money transfer, as I said, and that is very, very important. So what is happening is that it unbundled the banks. The payment application was unbundled from the banks. So which means that the application provider need not be a bank at all. They just connect in a very, very well-defined API manner. It's the name of the UPI is Unified Payment Interface. So it actually created protocols and interfaces to connect the banks among each other. And now today you can transfer money from any bank to any bank, any wallet to any bank. So this is actually the kind of, I can transfer 1 rupee to you, as little as 1 rupee to you without paying any money. So it's free, frugal, robust, reliable, interoperable, scalable, all these things. Aadhaar, the UPI is having 3 billion transactions a month, which translates to 100 million transactions a day. Now it's a record of sorts, because I think it has surpassed all the debit and credit card transactions in the country. And as you know, debit and credit cards have been in existence since last 40 years. UPI has been in existence since last exactly 5 years. It was launched by the Honorable Prime Minister in February of 2016. So I think these are two real, sort of transformations which have taken place, and they are having, ultimately payment is integral to any system. We are talking of National Digital Health Mission. Now in National Digital Health Mission also, you will pay the doctor, you will pay the person from whom you will get medicines from, you will pay the hospital. And if the payment system is absolutely digital, seamless, hassle-free, and remotely it can be done, what better can you have? So basically all these systems of digital identity, payment system, electronic KYC, all these things are going to be utilized in any other sectoral application which gets developed. And these are the building blocks which the country has created to enable other transactions or other platforms to be developed in a very short time.
Thank you. Do you see India's learnings from COVID evolving as a global best practice part of the health ecosystem, especially in influencing the vaccination administration policy and bringing the citizens closer to government healthcare system?
Well, I cannot say about other parts because I'm really not an expert in many other areas of vaccination, which is the logistics, the cold chain management, and other issues. So that's not really my forte. But what I can say is that from a technology perspective, what has been built, this platform, COVID, this is this has actually proved its utility not only in terms of managing the vaccinations at a large scale, but also, helping us in planning the vaccination strategies. So imagine, we now have a single source of truth, the dashboard, which actually provides us a real time, a near real time, it is actually upgraded and updated every hour. So real time, state of the vaccination being done in the country. So we know exactly which are the areas where less vaccinations have happened, which are the areas which have been saturated, what should be our policy, what are the AEFI, adverse, events following vaccinations, following immunization. So these are, then we can control them. We can realize whether these AEFIs are varying as per area to area, whether these AEFIs have got any relationship with the vaccine type. So I think a lot of public policy inputs come from COVID now. So this is an added advantage while you are managing the vaccination. At the same time, you are also getting a lot of data, and that data is providing you a huge amount of inputs for policy making. So that's actually the kind of stuff. Now, what we are thinking is this platform should be repurposed and redeployed for delivery of vaccinations of all kinds, immunization, polio, etc., etc. Why can't we make that real-time platform, and the ASHA workers in the countryside who make these things happen? They can just keep on plugging the data using their mobiles, and then we can have a real-time dashboard saying, really knowing which children have been vaccinated, which children need to be vaccinated. We can develop a system where we can say your child was vaccinated by first dose of this vaccine on this day. Now second dose is due, and the person will get to know, and then he can take initiatives to get his child vaccinated. So I think these are many advantages which can flow, and therefore I think subject to the government's sort of direction to us, I think we should be able to repurpose the platform for sort of managing and monitoring vaccination programs in general in this country.
Doctor, can you elaborate your answer? What are the next steps in direction of the Prime Minister to create an open source version of the COVID platform, and of course give it to the interested countries? And as you rightly mentioned, many countries are interested in the COVID platform. What role does National Health Authority play in hand-holding the platform to the interested nations?
See, the way we think about it is that open source and putting the platform on open source is the most important step, which should happen, so that the countries with whom we have a bilateral agreement, we will have some kind of agreement with these countries, because it's open, but it's an open source only for those countries who are actually going to benefit out of it. And also, so basically, we will have an MOU. After the MOU, this whole code base will be made available to those countries. And now the question is, who will train these countries? Who will actually help these countries in deploying the platform? Now, yes. NHA itself may not have the bandwidth to actually engage with each country separately. So what we have done is we have now collaborated with a number of entities. We had done an open request for empanelment, and there are about half a dozen entities which have approached us, and we are starting training of these entities. And once we have, and this is just about 3 days training, where we will train them on all aspects and all the applications and platform and the overall architecture of the platform to these people and this code base. Thereafter, we will give them some kind of certificate saying that this agency is now a certified implementation agency. Now, those agencies, the countries can take help of those agencies to basically, get the system deployed. And this agency empanelment is an open process. So suppose today 6 agencies have come, tomorrow 6 more agencies will come, we will continue to train them. So essentially, our idea is that we may not have the bandwidth to satisfy each query of each individual country. We have enabled, so to say, this is a similar thing which is called training of trainers. So we are training the trainers who will essentially help these countries doing that. And they are basically consultancy organizations which are international in nature, many of them. They will have their reach in those countries, and they will be able to help those countries. And today today's digital world, you can help anybody sitting anywhere, anytime. So that's possible.
So this software, can we see by end of this year, some countries can adopt, can follow?
Well, I really, there are more than 150 countries who participated in the global conclave. There were ministers from about half a dozen countries who spoke on that occasion. They also expressed their desire that we would like to get this software. And since then, we have been working on that. Now, ultimately, I cannot say as to which countries will finally adopt it and finally take it. They may have made their some own systems also, and they may find that going to this system may be difficult for them. I don't know how this will work out. So while I cannot give the numbers to you, I can only say that giving the feedback from the Ministry of External Affairs has been that there are, after 5th July conclave, there are many countries which have expressed the desire, and therefore we must provide them the necessary assistance. And as I explained to you, that we are going to begin this process, the real process of onboarding those countries in a short while from now. I mean, in a couple of weeks from now, for example.
Any timelines you have in mind for
I
keeping it?
don't have a timeline, because ultimately it is for the Ministry of External Affairs. We have done our job. We have open sourced the software. We have created the documentation. We are now training the entities, and we are providing all this information to the Ministry of External Affairs. Ministry of External Affairs will use their offices, their good offices. Probably the request from the countries will be received from the embassies and high commissions in those countries, and that is how they will come.
So you mean to say product is ready?
Product is ready. The technology transfer architecture is ready, so to say.
Okay, very good.
Now it's a question of actual implementation, and which I think also will be happening very soon.
Doctor, last question.
Yes, please.
Of course, the single truth COVID is meant for vaccine management. What is the next phase, your future vision for COVID and its roadmap?
One of the utilities which we see for COVID is to repurpose it as the vaccination platform for all kinds of vaccines in the country. That's number one. Number two, we are also having National Digital Health Mission. So COVID certificates will be one of the first digital health certificate for a person. And we have also used COVID after getting consent for issuing the digital health identities to the people. And therefore, going forward, COVID can become a front-end application for people. So Arogya Setu can become, COVID is actually operating largely through Arogya Setu and other applications. Those applications can become the personal health record applications also for going forward for people. And that will help people to consolidate their own personal health records, their own tests, laboratory tests, their prescriptions and other kinds of things. So I think this will become, the COVID has spurred a movement towards digital health records and digital delivery of health services in some sense.
Doctor, thank you very much for your valuable time and sharing your knowledge on the COVID vaccine management.
Thank you very much, Mr. Radhakrishna. It has been a pleasure talking to you.
An indeed powerful learning session it was. Thank you, gentlemen, for sparing your valuable time for this session. Dear viewers, do share these learnings on social media using the hashtag ETGIIHS.